Hey guys, I'm Molly from All Healthcare Careers. I'm going to be performing step-by-step CNA skills to ensure your success on the CNA clinical skills portion of the exam. Before we get started, I'd like to show you this CNA practice kit that we put together for you to practice at home with family and friends. It will be linked down in the description along with a video breaking down exactly what's inside the kit. Let's get started. Before entering, I'm going to perform hand hygiene, 2 pumps of hand sanitizer. I'm going to knock on the patient's door to let them know I'm entering. Good morning, Mrs. Smith. I'm Molly. I'm going to be your CNA today. How are you doing?
Good.
Good. I hear that you would like to get up and do some walking. Is that correct?
Yes, please.
Wonderful. Okay. What we'll do first is we're going to get you sit up in the bed, and then I'm going to have you turn around and we'll get your shoes on. Okay? Wonderful. Okay. Okay. If you can place both of your hands up on my shoulders, I'm going to help lift you up on the count of 3. Ready? 1, 2, and 3. Perfect. Place your hands down. Are you feeling okay, Mrs. Smith? Mm-hmm. Wonderful. Next, I'm going to come down and take both of her legs, and I'm going to gently swing them around to the end of the bed, and I'm going to let her feet and legs just dangle for a few seconds, making sure that she is okay to go. Are you feeling okay still? Mm-hmm. Wonderful. Next, I'm going to, if you could just scoot just a little bit forward. Perfect. Next, I'm going to place Mrs. Smith's shoes on her feet, making sure that they're non-skid, which they are. If for some reason your patient does not have shoes or is unable to wear shoes, you can always do non-skid socks. But shoes are always going to be your first choice, giving them extra stability when walking. Making sure both feet are spread apart and placed firmly on the ground. Let's go over quickly how to use a gait belt. You're going to take the end of the gait belt, you're going to loop it down and up through the teeth. These are the teeth. You're going to pull it all the way over depending on how tight you need this for your patient. Once you have the spot that you would like it, then you're going to take the end of this right here and you're going to loop it through just like that. And then when you're ready to take off the gait belt, you're going to loop back through the belt and then loop down again, just like that. Next, I'm going to get my gait belt. I'm going to have Mrs. Smith lift her arms up, and I'm going to place this around her waist, making sure that it is nice and snug, but not too tight. Oops. I'm going to loop it through the belt. Up through the teeth, and then loop it again through the belt. Then I'm going to take my 4 fingers and place them inside, making sure that there's still enough room, but that it is snug. Mrs. Smith, does that feel all right?
Yes.
Wonderful. Next, I'm going to place my foot in front of Mrs. Smith and then to the back to making sure that I still have good body mechanics. Now we're going to transfer Mrs. Smith from the bed to the standing position. Mrs. Smith, are you ready?
Yes.
Okay, I'm going to have you place both of your hands up on my shoulders and neck, taking both of my hands underneath the belt and then having her stand on the count of 3. Ready? 1, 2, and 3. Perfect. Then I'm going to have Mrs. Smith put her arms back down, placing her left foot in front of mine to pivot. Go ahead and pivot to the front, just like that. And then I'm going to take my hands behind the gait belt, holding and having stability. Now you could have a patient who has weakness either on the right or left side, and depending on that side, you're going to want to give additional support standing on that side in the event that there could be a potential fall or that they just need extra assistance. All right, Mrs. Smith, we're going to start to walk slow and steady, 1 foot in front of the other. Here we go. Good job. Always checking in the event that your patient is starting to feel dizzy, short of breath, or overall unwell, you're going to want to find the nearest chair or bed to have them sit down. Okay, now we're going to turn back, heel to toe. Good job. We're going to walk towards over the bed, having Mrs. Smith standing right in front of me again. Mrs. Smith, can you feel the bed on the back of your legs?
Yes.
When the patient gives you the verbal okay that they can, then you're going to want them to sit back down. Okay, on the count of 3, we're going to sit. 1, 2, and 3. Good job. I'm going to take off the gait belt. Thank you. And then next I'm going to take off Mrs. Smith's shoes. And then I'm going to have Mrs. Smith put her arms up on my shoulders again so I can help her lay back down. Okay, we're going to turn just like that. And then I'm going to get her legs and place them up on the bed. Covering up Mrs. Smith. And then asking, is there anything else I can do for you today, Mrs. Smith?
No, thank you.
Wonderful. Okay. Or exiting the room, I'm going to perform hand hygiene again, 2 pumps. We hope you found this video helpful. For additional resources, click the playlist for more CNA skills videos. Or try our 3 free-day trial that contains over 1,000 practice questions to ensure your success on the first attempt.